A very warm welcome to all our viewers. Today we have with us the founders of onco.com, one of the country's first internet aggregators and online platform in the health tech space that specializes in cancer care. So we get up close with Rashi Jain, co-founder and CEO of onco.com, as well as Dr. Amit Jotwani, co-founder and chief of medical affairs on the platform. So Amit, let me begin by really setting the context of the space that you work in. We recently observed World Cancer Day, and while it is also a day where we celebrate survivors, the World Health Organization has stated that cancer is one of the leading causes of mortality, as well as about 15 million people worldwide discover that they have cancer on an annual basis. So what is the relevance and significance really of working in this space?
So it's very important to really fight cancer at the face value itself, because the way it is rising, the incidence of cancer is rising at a dramatically fast rate. In India itself, last year in 2018, the Globocan data that measures the global cancer incidence, the Indian incidence was more than 11.5 lakhs. And according to rough estimates, this number is less. Actually, it should be 15 lakhs because a lot of cases go unreported. Now, the problem is that we need to talk about cancer. We cannot have a stigma attached to it. So that is why the events like World Cancer Day help us come together and talk about it, and we can talk about ways to fight it, ways to prevent it, and really solve it for the patients and the caregivers who are really fighting a lone battle against it.
So you've called it a lone battle, and onco.com is, of course, your main vision and aim is to, provide patients a sort of a 360-degree, platform for all their concerns. I think when you launched initially, it's been about 3 years since inception. You started off with providing second opinion from a panel of experts to patients and families. You've gone on to provide many more services. So take us through a few of them.
We started with the most acute problem that cancer patients had, which was that they did not get the right treatment advice. So we started with building a network of really expert oncologists from India and US, and made this service available to cancer patients around the world, specifically with a focus in India. And after providing an opinion, a multidisciplinary panel opinion, patients and their families started coming back to us, asking us, okay, where can we get this treatment? And that is when it dawned on us that actually even discovery of doctors, discovery of the right hospitals, right treatment centers is a big challenge. And that led us to start our Onco Connect service, where we also provide personalized recommendation on the right oncologists and connect the patients with these doctors. And over time, we realized that there's a third problem that cancer patients face, which is that when they go through this 2-year treatment journey, they are really confused, and they need some support system where they can just reach out to and get all their answers, all their questions answered. And that is where OncoCare Management came in, and we very formally started mapping our customers to a care manager. That person becomes a one contact point for them, and they can avail any of these services. So that's how the umbrella sort of panned out in the last 3 years.
Right. Like you mentioned, and it is widely known that cancer is largely a very complicated and confusing disease. So in a country like India, what would you say is really the missing piece? Would it be like, patient-centric care, information and unbiased opinion? How is a startup such as yours aiming to revolutionize this space?
Most important problem is access to right oncologists. Most of the trained oncologists are residing in metro cities or tier 1 cities, but majority of patients are residing in tier 2, 3 cities. So they don't have access to right care in form of the right expertise that they should be getting. Second problem is the comprehensive care that is required. Cancer is a complex condition. It requires multidisciplinary care. It requires surgical specialty, radiation oncology, chemotherapies or targeted therapies. Now, as the science is advancing, the complexity is rising. Even a lot of doctors are not aware many times. So we need specialized oncologists. So how we are changing it, we are bridging the gap of access and information. Access to oncologists is a major problem. Now through onco.com, any patient from the comfort of their home can get access to senior most oncologists in India or US. In cancer, right treatment is as important as treatment itself. So we provide them right treatment plan from those oncologists. Even though they can't travel to those cities, at least they know what is the best treatment for them. And by bridging the information gap, we are making the patients and caregiver participate in the decision-making process. Normally, healthcare is the only sector where the customer does not have any power.
Okay, so you're also educating them in a sense to be able to, empower themselves to ask the right questions.
Exactly. Whenever it has been found that whenever the customer has enough information to ask right questions, the system automatically becomes fair towards them.
So you are aiming to become a one-stop destination for cancer treatment. How so are you going about doing this?
Our services involve the patient right from the beginning of their treatment journey. So as soon as the patient or their family need advice right after their diagnosis, they can come to onco.com. We'll give them an opinion, telling them clearly on what are the right tests for them, what is the right treatment for them, and who are the type of oncologists that they should be meeting with. Once they empower themselves with this information, we will help with discovery of these service providers in their preferred location. Of course, there are scenarios where patients can't travel and they have budget constraints, and our recommendation algorithm takes that into consideration, and we are able to offer a very personalized recommendation on who's the right doctor for them. Once we help them identify these service providers, we also help them connect with them. And we provide priority appointments and bookings, as well as offline and online care management support. So our care manager or care coordinator will engage with them prior to their appointment and post their appointment, helping them then plan the rest of their treatment. Once they have their appointment and they have questions around the right treatment, they can avail an unbiased, independent opinion from Onco's platform, where we will form a multi-disciplinary panel of really senior doctors, maybe oncologists who are not available locally in their city, but they can get access to these doctors through us, and we'll provide a comprehensive opinion on what is the right treatment for them, what outcomes they can expect, and if there are any other questions that they had, we are able to answer that. Once they start their treatment journey, we map them to a care manager who will engage with them throughout their treatment journey. But pretty much building this entire oncology ecosystem, whether on the doctor side or the hospital side or the lab side, is what our focus is, has been, and will be in the coming years.
Yeah, that sounds like a very refreshing approach, a lot of work behind that. Coming to your services and the demand for it, what kind of registrations are you witnessing probably on a daily or monthly basis? And in terms of your consultation turnaround time, where does that stand?
Every month, more than 10,000 patients are registering on our platform. And most of them are from India, and a lot of patients come from other countries like Middle East, Africa, surrounding South Asia and all. Total 18 countries we have been getting the patients. On the turnaround time for a tumor board service, where more than 2 or 3 oncologists have to come together and give an opinion, the turnaround time used to be 5 days. Now we have come down to 3 days. So within 3 days, a patient can get a detailed opinion about their treatment options and the expected outcomes and prognosis, everything. And more, we have served till now more than 1 lakh patients through the platform itself. This also is due to the new algorithm that we have launched. It's world's first platform dedicated for cancer patients, where any patient can come on the platform, give 4 inputs about the disease in a very lucid, simple English language, and get a detailed plan about their treatment options going forward, the tests they should have done, and the oncologist specialist they should be seeing. So this information itself is lacking. We have a lot of clinical decision support systems for doctors, but for patients there is no platform.
Right, interesting to see the amount of tech that's being put into place in the back end as well. In terms of the model that you follow right now, it's positioned around a B2C model where the patient or the consumer is charged a direct fee. But as you grow, and you've mentioned that your specific focus would be on middle income countries. So are you looking at different models? You've also raised a Series A funding very recently.
We have to expand our patient outreach efforts. And for the next 12 months, I think India alone is obviously a very big market for us. We are basically a drop in the ocean, and the need is huge, and we have to make sure that every cancer patient and their family in this country can avail one or other of our services. And in terms of our immediate focus after India, we would want to expand our outreach to African countries and Middle Eastern countries, where we are seeing that a lot of patients are in need of the right advice, and many of them actually travel to India as well to get their treatment. Many times they don't need to travel, they are just actually traveling for advice, and that is a gap that Onco can fill in beautifully by positioning ourselves as this one place they can get advice from the best experts in the world. So that's pretty much in terms of our geographic expansion. And then of course, like you said, technology has played a critical part in making sure that we develop such cutting-edge solutions. I think that will become more and more prominent as we scale, because the kinds of products that we are talking about are really complex products. Providing an opinion which is medically accurate to a patient in a semi-automated way isn't an easy feat, and there's a lot of intervention of some of the best doctors in the country and engineers that goes into building these products. And I think in the next 12 to 24 months, our focus will be to bring more such cutting-edge technology solutions to automate this process of getting the right advice.
And talking about the softer side as well, you earlier mentioned some sort of community building or creating a support system. What kind of work are you doing on that front?
Yeah, so this was something that actually was initiated by us. It's been 8 months. We realized that a lot of cancer patients and their families go about this extremely complex, extremely chaotic experience on their own. It's still considered a taboo, and people don't have a support system. And this is very unique to our country, where people don't like to talk about their cancer journey, or even people who are going through it, they don't talk about it. Yeah. So we wanted to build a community of cancer patients, survivors, family members, people affected with cancer around the world, build that community, make it accessible to the patients. And we did that, and today we have 6,000 patients from around the world who are part of this active community. We also started something called Talk Your Heart Out, which is an offline event. This happens in 6 cities in India every month. This was actually the first month where we launched it in 6 cities, where we invite people who have been affected with cancer, survivors, others to come and share their story. And people who want to seek support emotionally or get practical advice can just attend these events and then get all the support they need.
Right, it just makes everything more bearable and more realistic to deal with. In the course of our discussion, I think we've established that we have a very skewed oncologist to patient ratio in countries like India, and a broken chain in a sense when it comes to cancer treatment. So what is Onco's end goal and a future vision?
See, if you see the problem of oncologist to patient ratio, in India for one oncologist we have 2,000 patients, while compared to West where there is an oncologist for 100 patients. So we are at a fraction of what we see in the US or European countries. So that problem cannot be solved overnight by getting more doctors suddenly. It would take more than 20 to 25 years to get that number of doctors, and by that time the cancer number, patient numbers also would be multifold. So the technology solution is the best way to address this problem. As I mentioned before, right treatment is very important. We did a study. In our study we found that 40% of patients who came, up to 40% did not have complete tests done. So unless you know the disease completely, you can't treat it properly. Then we found that 15% patients who came to us were on a wrong treatment path. Now this is not a fault of oncology or something. This is the problem of the system, where we don't have a multidisciplinary approach, we don't have adequate oncologists. Many times affordability issues are there. Patients cannot travel to bigger cities many times. So we are trying to bridge these gaps, at least guiding them on the right treatment path. The cost part, we are addressing the cost part because ensuring right treatment ensures cost effectiveness. We are adding value to the money spent by patients so that they get right treatment. Another statistics that is important to know, that incidence of cancer is in India is less compared to Western countries on a per population proportion basis. But the mortality, death rates are much higher. So in the developing world, less than half of cancer patients are getting diagnosed of the world. But more than 70% of deaths due to cancer happen in developing world, including India. And the sheer population density we have in India, this is going to become a very big problem. So that way we are trying to bring the change in this ecosystem and make it better for the patients to improve the outcomes.
And that's interesting to really see the kind of impactful work that the two of you are doing. Thank you so much, and kudos to the both of you. All the very best going forward.
Thank you.
For the latest updates on the Indian startup ecosystem, subscribe to our YouTube channel and press the bell icon.